Well, as we've mentioned all month long, October is Breast Cancer Awareness Month, and the Tennessee Titans want you to know they care. October is Crucial Catch Month in the NFL, raising awareness for early detection and risk reduction. Breast cancer has impacted so many lives, including these Titans.
What's up? I'm Caleb Farley, and I play for my mother, Robin Farley.
I'm Derrick Henry, and I play for Rachel Rivas.
Hi, I'm Ryan Tannehill, and I play for Marge Tannehill.
I'm Amani Hooker, and I play for Chelsea Hooker.
My name is Kevin Byard, and I play for Valerie Mitchell.
I'm Mike Vrabel. I play for Shirley Fuller.
My name is Laurel Murchison, and I play for Forward Murchison.
Clearly, so many people impacted by this. And right now, we are joined by Dr. Laura Lawson. She is the breast surgical oncologist with the Nashville Breast Center and medical director of the Ascension St. Thomas Breast Cancer Program. Let's talk prevention. First of all, welcome. We're glad you're here. Let's talk about prevention. You know, we talk about eating healthy, working out. What else can we do?
Well, certainly eating healthy and maintaining a healthy body weight is good to help prevent breast cancer, but it's also good for just one's health in general. Sure. I mean, so certainly all the things that we know we should do, things that we should eat, and getting more exercise is always helpful. I know we're going into the weekend and it's fun times, but avoiding excessive alcohol intake also is helpful. Certainly avoiding cigarette smoking, wearing sunscreen is really helpful to avoid sunburns. So lots of things that help with just decreasing cancer risk, but also just general health risk. Some things we can't really do much about, though. The biggest risk factors for developing breast cancer are being female and getting older. So not so much we can do about that, but there are lots of things that we can be healthy and really be concentrating on maintaining, being as good health and maintaining as much of an active lifestyle as we can, and that is certainly helpful.
Well, speaking of age, you know, I'm not 40 yet, and I have asked to see if I can get an earlier mammogram or checkup because I have cancer in my family, female cancer in my family. And all the doctors say, not yet, wait till you're 40. Why is that? And is there anything people can do if they do want to get kind of an earlier check?
Oh, definitely. So one of the big issues is most breast cancers develop in women who are over 40, even really over 50. It's kind of, again, being female and getting older. And so doing mammograms on women much earlier, we'd be screening lots and lots of women and just not finding anything. And so we sort of looking at all the data and when people are diagnosed, 40 is sort of a good age. And so we recommend that women who are at average risk, so women that don't have a strong family history, start getting mammograms at 40 and then get one every year. For women who are younger than that or that have a family history, we usually recommend for those women starting at 10 years before the youngest person was diagnosed. So if your mom was diagnosed at 45, then you should probably start getting imaging and being looked at 35. So that is something that moves that dial back a little bit. The other thing that's really important is mammograms are only part of the story. I mean, they are the only screening tool that actually improves survival for breast cancer. But what's really important is for women to just know what's normal for them. So doing a self-exam, you know, making sure that you know what your normal lumps and bumps are, so that if something pops up, you can say, oh yeah, that's what that always feels like, or oh, this is something kind of different, and maybe waiting through a couple menstrual cycles, and if something that persists, then you say, okay, I need to have this looked at. And so then typically if you meet with your provider, they will also do an exam. So meeting yearly with your provider is also an important part, certainly for prevention and early detection, because sometimes it's your doctor who finds something. A lot of times it's the woman themselves, but it's sort of, it takes a village. There are lots of different ways that we find things. And so certainly if a woman finds something, their provider notices something, then we're happy to go ahead and get imaging. So it's not really that no one wants to. We're just trying to make sure we're utilizing resources to the best way we can and making sure that we get everyone taken care of.
Really quickly, last question for you. Should you do self-test the same time every month? And is it better to do it standing up, laying down? What do you recommend? Really,
just however you're going to remember to do it. That's the key thing. Just do it at some point in time. And that it was really what kind of, you know, the thing I talk to a lot of patients about is I think sometimes women don't want to do a self-exam almost out of fear, that they feel like, you know, if I do an exam and I find the thing, all this bad stuff happens. But in reality, you're just trying to figure out what's normal for you so that if you notice something different, you can say, oh, okay, this is something different. I should have it looked into. Most things turn out to be fine. There are just lots of lumps and bumps that happen.
No,
so really, whatever you're going to remember, if it's the first day of the month, the last day of the month, I mean, ideally, we like to recommend that women do it at a time of the month that things are the least sore and lumpy and tender, but that's hard to remember. I think probably the first day of the month is going to be a little bit easier.
Okay, I like that.
Great.
That makes it sound a little less scary.
Great information.
Thank
yes.
you
Thank
very,
you, thank
very
you.
much. Well, please read more about all of this and check out Dr. Laura. You can visit the website on your screen, healthcare.ascension.org.